You're at your shift in the emergency department when a 50-year-old male arrives complaining of a new skin eruption. He says the rash developed suddenly over the past 2 days and describes it as a bit itchy, although he's mostly concerned by the way the rash appears, long linear welts clustered together. The first cluster developed on his chest, followed by another cluster on his back. As you take a history, you find nothing remarkable in his health history. He mentions he recently ate at an Asian food festival, although he's eaten similar foods before and has never had a reaction to them. On examination, there are no systemic signs. His vital signs are normal, and aside from the lesions, there appears to be no signs of any chronic skin disease. The lesions themselves are linear, occasionally crossing the midline, as well as crossing dermatomes. They're also mildly edematous. It looks like dermatographism. As a quick test, you scratch his skin and nothing appears in that location. The skin is dry and there isn't any weeping or discharge. You follow up asking a few more questions about atopy, but the patient has no allergies, not to foods, environments, or medications. We're not going to keep you in suspense. The patient has a particular type of food-associated dermatitis. These lesions are described as flagellate, which is another way of saying that they look like whiplash. If you've ever heard about a flagellate dermatitis connected to foods that contains mushrooms, you've nearly got the diagnosis. This patient has Shiitake dermatitis. Congratulations to Figure 1 star dermatologist N.E. Bushwhacker for identifying the condition. The lesions are caused by a compound present in Shiitake mushrooms called lentinan. In a few papers, lentinan has been described as activating certain types of leukocytes. As an aside, this compound has been isolated and tested as a form of chemotherapy for some types of gastrointestinal cancers in Japan, where cases of flagellate dermatitis have been described as a side effect of the treatment. When thoroughly cooked, lentinan is degraded by heat, reducing the risk of dermatitis for most Shiitake mushroom lovers. However, consuming raw or undercooked mushrooms containing the still active lentinan can initiate a cutaneous inflammatory response. The characteristic linear rash develops within 2 days of exposure, and the diagnosis is often clinical, based on history and examination findings. The condition is self-limiting, typically resolving within 3 weeks, though it can recur with repeated exposure. Management is supportive, and treatment with oral corticosteroids is unnecessary. There have been case reports of Shiitake dermatitis presenting with linear collections of vesicles in a dermatomal distribution. So the differential diagnosis includes an atypical presentation of herpes zoster, allergic dermatitis, or drug eruption. The presence of fever, lymphadenopathy, severe pain, or edema should raise suspicions of another diagnosis, including drug reaction with eosinophilia and systemic symptoms, or DRESS for short. We hoped you enjoyed this case. Thanks to Figure 1 star R. Fazikov for posting this case on the Figure 1 platform, and to everyone who participated in the conversation around this case. This case is accredited for CME, so head to Figure 1 to complete the activity and claim your CME credit. The link to this case, the CME credit, and discussion with other healthcare professionals is in the description below, so the fun doesn't have to end here. There are thousands more real-world medical cases on Figure 1, so don't forget to visit us and sign up so you have access to the most valuable and interesting medical cases to help sharpen your clinical skills. Figure 1. Seeing is believing.